Welcome back to Chat It Up, the podcast where we turn dentistry into a delightful conversation. Hi, I'm Bita, your smile-seeking host, and today I have the honor to welcome a fun dentist on the show, Dr. Sepehr Rahmani.
Hello.
Hello.
How are
Welcome
you?
to the show.
Thank you.
Welcome to the show. I'm just
Glad
gonna
to be here.
Thank you. I'm going to tell our audience who you are and a little bit, and then I'm going to get you to explain who you are and where have you been and where you're practicing.
Let's do it.
Right.
Let's rock and roll.
Dr. Rahmani's story begins in Ontario, where he explored his love for health sciences while studying at the University of Ottawa. His journey continued at the University of Western Ontario, where he delved into the world of dentistry. Captivated by the charm of West Coast, he settled in the Lower Mainland. Finding joy in its beauty and climate, Dr. Rahmani enjoys skiing, hockey, basketball, and performing arts. He enjoys making a positive impact through charity and community involvement, embracing life's adventures with an open heart. Welcome to the show.
Glad to be here.
Thank you
it's
for
an
being
honor.
here.
It's an honor.
All right, tell our audience who you are and what you practice in the dentistry world.
My first name is sepehr, Dr. Sepehr Rahmani. I've been practicing in the Lower Mainland for now, this is my 21st year practicing here. I grew up in Ontario, as you said. I grew up in the city of Ottawa. I did my undergrad there. I moved, and then I did my dental school at the University of Western Ontario, graduated in 2003. Go Mustangs. And I moved straight to BC because I had a lot of family out here. I wanted to live on the West Coast. Associated for various doctors for about 3 years, and I bought a practice in North Vancouver. I took over the practice of Dr. John Richmond in North Vancouver in 2006. Over the years, I had expanded that practice, and about 4 years ago, I also took over a practice in Squamish, BC. So I practice out of those offices mainly. So I do general dentistry. My interests are general dentistry, and in particular surgery is a particular interest of mine. So I do general dentistry, surgery, cosmetic dentistry out of my office in North Vancouver. But when I go to Squamish, I do mostly surgery. So from gum grafting to wisdom teeth, implants, sinus lifts, those sorts of things are my interest. And that's where I'm at.
That's awesome. That's amazing.
Keeps me busy, that's for sure.
So let me ask you some questions. Some are going to be funny stories. Some are going to be educational. Let's start with educational. If you have any kind of advice for anyone that wants to become a dentist or get into the dental world in Vancouver, what do you suggest?
Well, this isn't necessarily a Vancouver thing. I would say as a general rule, I think one of the biggest determinants of my success in my field, or where I've found the most sort of affirmation and satisfaction, is in the relationships that I build with people. Okay. Having a successful dental practice involves building relationships with people. Whereas in other health fields where you might just be seeing that doctor once for a surgery, let's say it's an orthopedic surgery or a plastic surgery or a dermatologist or what have you, in dentistry, generally we're seeing our patients every few months. And so over the years, you're really developing relationships with these people. You get to know who their family members are, who's graduating, when they're getting married, divorced, those sorts of things. So you're a part of their life, and you get to see them out on the street, and it's really a form of community building. And
true.
so if you have to take a genuine interest in people if you want to be successful in this profession. They're not just the 32 teeth that they have.
That's very
There's
true,
a person behind those 32 teeth. And so you really need to know who they are, what their story is. Remembering people's names is a big deal as well. So these are individual people, and they matter. And so making them understand that they matter and giving them that sense that they matter, that is really going to go a long way into determining how successful you're going to be as a clinician.
100%. And I totally agree with that. It makes someone feel good if you're walking down the street and you're like, oh, that's my patient, Susie.
Yeah.
And when you say, hi, Susie.
How's
they're
Bob
like,
doing?
exactly.
And how's
like,
Bob doing? How are the kids?
Exactly.
How's Joe and Diane doing? You know, like
what did you do for your birthday?
Yeah,
you know?
exactly.
It's like, oh,
Yeah.
he actually cares. I'm not
This
just a
is-
number. I'm not a dollar sign.
They're real. They're genuine. The relation, and I do sincerely care about these people. Like they matter to me. I think about them when I'm not at work. I worry about them if they're having health concerns. So they matter to me, right?
That's
so,
amazing.
Yeah.
You know, and that's what you want in a dentist because in this day, you know, everyone's so scared of going to the dental office. But if you're making a relationship with your patient and they make you feel that you're a part of their family, they trust you.
Absolutely.
So
yeah.
and that trust comes a long way, I believe. So here's a funny question I want to ask you. What is the strangest thing you've seen in somebody's mouth being lodged in between teeth that you had to pull out?
Okay, that's an interesting question. Let me think. Oh yeah, you know, there's this elderly patient that I had. He's, God bless his soul, he's since passed away. And he was this really delightful little Italian man. And his daughter called me one time. She was a grown lady, of course. And she said, my dad's tooth has broken off. It was a filling you did recently. And I'm like, oh, okay, interesting. Let's bring him in and let's have a look and see what's going on. Let's find out what happened. Because it looks, you know, I feel like I did a good job on him. What would have broken? So he walks into the office with his daughter and he had the tooth wrapped in a little paper towel. And so he opens up the tooth to show me the tooth and the filling that was in there, and it was an almond without the skin on it. So he had taken an almond and taken the skin off of the almond, and he thought that was a tooth. I guess it was stuck between a couple of his teeth, and it had come out. He thought it was his tooth.
Oh my goodness.
But it was an almond.
It was an almond.
So, yeah.
Taste it before you say it's a tooth.
That was pretty funny. We all had a good laugh. We all had a good laugh.
That's good.
Nothing
that's
was,
good.
in short, nothing was wrong with the filling.
That's good.
But there was an almond in there. Yeah.
So here's another thing. What's the funniest thing while you were working on a patient and patient said to you while you're working on them?
When I was in dental school in London, Ontario, when our patient would arrive, the receptionist in the main student clinic would call us on the loudspeaker and say, sepehr rahmani, number 10, which meant that your patient had arrived. So we'd go to the main lobby and pick up our patient. And there was this delightful El Salvadorian woman, Hispanic lady. And I had just met her once before, and she came in, and she was just going in for a routine cleaning. We were students and we were practicing on these patients. So I tried to be charming with her, and she says to me, she goes, forgive my accent, but I'm just gonna do this one. She goes, I did not remember your name, so I asked for the Persian guy. And so I just responded to her, I go, just ask for the handsome Persian guy and they'll know exactly who you're talking about. And then she says, oh really, you are handsome? And I'm like, oh, I'm not. Guess I'm not. She goes, so in your country, do they think you are handsome?
No way.
And I'm like, so I guess in your...
Did she actually
No, I don't
say
know.
that?
She did. I go, I guess, no, I'm not sure. In your country, I guess they don't. She goes, no, not really. And then we just went on about our day. That was pretty funny. It's a humbling moment.
Did you not say anything to her?
We had a delightful day. She was one of the sweetest
Okay.
ladies, but that was a funny.
I'll make you
That was a
laugh.
funny encounter.
I think you're handsome.
Why?
Dr.
I
Rahmani.
appreciate that. Thank you.
So if teeth could talk, what do you think they would say?
Wow. Stop kicking our ass all day.
All right.
I mean, think about this. I often talk to patients about this as well. We don't think twice about having like a 3 or 5 year warranty on a car. You break down the parts and pieces of a car. It needs to be fixed. If it's been 6 years, the mechanic just knows that you've been driving your car. It
Wear and
breaks
tear.
down. What about your tires? You have to get your tires replaced. There's never a warranty on tires. You only drive your car about half an hour to 45 minutes, let's say, a day. And that's not even every day.
That's right.
Well, how often are you using your jaw? 24/7. Even when you're sleeping, you're using your jaw. You're eating at least 1,000 different meals and snacks every single year. And you're basically beating it up all day long, every single day. I mean, I think patients really need to appreciate that the fact that any of our work lasts at all in the mouth in such an environment that's just getting just pounded every single day is a miracle.
It is.
And
work.
so I think that people's expectations need to be tempered. I've seen crowns that broke, and patients have had a crown in their mouth for 15, 20 years. And they're like, well, why do I need to have this crown done again? It's been in my mouth for 20 years. Why should it, when it was done, it should have been fixed. And I'm like, you've been using it every single day for the last 20 years, and you're upset that you have to redo a crown. How much does it cost to get a new car? Have you had a car for 20 years? Have you had parts in the car for 20 years? So that would be a misconception, or that's, if your teeth could talk, they'd be like, please help. Just give us a break every now and then.
Take care
That's
of
what they
us.
would say.
Yeah, I like that. People don't know. I was talking to somebody just before the show, and they don't know how important it is to have teeth, because once we get older, we get a whole bunch of health issues that we don't really have a hold on, or we can't control. But if we take care of our teeth, it's going to be so much easier to take out the future problems from them, because you have to wear dentures, you have to wear implants.
Well, that's a common misconception that people have about having dental work done. Is one of the misconceptions fundamentally is that people feel as though, I'm older, I'm going to lose my teeth, and that's not necessarily the case. I mean, you're not supposed to lose your teeth.
That's right.
They're designed to be in your mouth for a reason. And so another misconception is, I don't want to have dental work done because it's going to hurt. That's another misconception. Dental work, while you're sitting in my chair, you might feel a little bit when I'm giving you the anesthetic. That's it. Little mosquito bite or what have you. But while I'm working on you, there shouldn't be pain while I'm working on you. So it's a old wives' tale that I constantly hear my patients telling me stories about their childhood, where they give me they give me these stories about when their doctor was putting their knee over them to take the tooth out, and I've never heard of that. I've never seen that before. It's not like that. It should be a comfortable experience for you.
It's a fun environment.
You got TV going, you've got noise-canceling headphones, you don't have to listen to the drill.
That's right.
We've got Netflix playing for you. I'm not saying that it's the most pleasant experience in the world, but it shouldn't be a torture session.
It's not.
We're not in the
honestly
business of torturing people.
No.
We're in the business of trying to make
We're
things
the
comfortable.
good people.
We're trying to make things comfortable for them, and it isn't a bad experience. It's a comfortable experience for the most part for most people.
That's true.
Are you in some discomfort during the appointment when we give you the anesthetic? Sure, but the appointment itself should not be hurting. Even root canal, which is traditionally known as a painful procedure, it's not a painful procedure. It shouldn't be, at least, a painful procedure.
I totally agree with you, and that's exactly what I wanted to talk to you about. Glad you touched that up for me, because that was the next question I was going to ask you, the misconception that people have in a dental health, taking care of their teeth, and how important it is to take care of your teeth. Before we wrap everything up, I want to ask you, what is the most rewarding part of being a dentist, and just personally, not just doing teeth?
Well, that's a great question. It's all I've been doing as a profession for the last 21 years, so it's the only frame of reference that I know. I'd say the most rewarding part is the relationships that you're building with your colleagues, with staff, the relationships that you build with people. This week is a dental conference in Vancouver, and I expect to go there and see a lot of my old friends that I don't get a chance to spend time with, and so the relationships that you build, the camaraderie that we have for each other. One of my best friends from dental school recently had a heart attack a couple months ago, and we were just talking about how much love, the outpouring of love that he got from his colleagues, and just to know that like we're, sometimes we tend to have a competitive nature about us with each other, but when it comes down to it, I think that there is a sense of camaraderie and and togetherness that we have as a community of colleagues. So that's been a very enjoyable part of the job. Also, the chance to sort of challenge myself, to take my clinical skills to another level.
Yes.
Over the last 20 years, I've spent a lot of time and resources on continuing education to like travel around and to learn new skills. And every single time I'm about to sort of implement a new skill into my practice, I find that like it's just a very exciting time, and it keeps you amped up, it keeps you motivated. Also, just the exposure to the AI and the technological advances that we're having as a profession.
Yes.
It's rewarding to be a part of that.
Yes.
With digital scanners that we use, CT scanning, the way you can merge these files to create beautiful, exact precision in your work. It's just a really enjoyable and exciting time to be in this profession.
For sure, I totally agree, and everything is changing.
And at the end of the day, regardless of whether you're a dentist or whether you're whatever it is you choose to do, you have to do what you love, and
100%.
love what you do. I know that we've all kind of used this term. I sincerely, viscerally feel it from the bottom of my heart, and you have to really care about what you do. I care about my patients. You got to care about the quality and the consistency of your work, and that's what's going to constitute success, in my opinion.
That's what makes you a great dentist.
Thank you.
You know,
that's what I try to
always
do.
refer patients to, and
Appreciate it.
the fact that you care for patients so much and you make them as your own, you treat them as your own family, and they can trust you. It goes a long way. So thank you for that. I appreciate you coming on the show, taking the time of your busy life of being a dentist. Even though you have crutches with you, you still go everywhere.
Yeah.
And one last question:
Yeah,
climate.
I tore my Achilles tendon playing basketball a few weeks ago, so I'm walking around I'm walking around a little crippled lately. Yeah, I'm crutches. Yeah.
Last question. You don't ignore my climate.
Oh, the climate. Listen, I'm married.
Vancouver and
My
its
wife,
climate.
my wife is from California, and she can't stand the climate here. I will allow for that for sure.
Okay,
Our
thank you.
summers, though, you can't beat our summers.
It's around
here.
the corner.
Our summers
It's
are
around the corner.
unbelievable here.
It is.
Yeah,
Well, thank you for being on
For
the
sure.
show. I appreciate it.
it's a pleasure.
And once again, thank you for watching the show. And don't forget, with me, it's never a podcast. It's a chat worth smiling about.
I'm smiling.